Hello and welcome to the Empowering Family Caregiver Show, brought to you by eCareDiary.com. I'm your host, Susan Baida, host and co-founder of eCareDiary.com. So today is Friday, March 11th, and the focus of our show is energy healing. And I'm very pleased to introduce you all to Dr. Marie Chiasson of Arizona, who is here to talk to us about energy healing. Now, Dr. Chiasson is a family medical doctor, and she also is the author of Energy Healing for Beginners, which is available on DVD, and also a new kit called Energy Healing, The Essentials of Self-Care, which will be available starting March 16th, which is this coming week. These are both available on Amazon.com. She also co-authored a CD with Dr. Andrew Weil, who is renowned for his work in integrative medicine, and that is called Self-Healing with Energy Medicine. She was also the medical director of Valor Hospice in Tucson, Arizona. And she has a private practice and also teaches at the Center for Integrative Medicine at the University of Arizona. Welcome, Dr. Chiasson.
Thank you.
So now you were trained as a medical doctor, and now your focus is energy healing. Can you tell us what exactly is energy healing?
Energy healing is actually an ancient art of working with the body through touch and vibration and sound. The idea is that there's an energy body with a physical body, and that part of our physical health is related to the underlying energy flow. It's an older idea that actually underlies most of healing paradigms until about the 1800s. In the 1800s, we switched to organ systems, cardiac, kidney. But before that, we talked about an underlying vital force or an underlying energy in the body. So energy healing is the art of sacred touch, and all the older sort of paradigms, which we're finding now for chronic diseases and for chronic pain, work really well along with conventional medicine. So I actually practice both.
That's wonderful. Now, how can energy healing, our audience is really mostly family caregivers, how can that benefit family caregivers?
It can a few ways. Touch is primal. It's pre-verbal. So when we touch another, they get the sense of the quality of touch. Mm-hmm. So it's quite healing, and it immediately goes to the autonomic nervous system, to our stress response. So it begins to relax us. Mm-hmm. And of course, what relaxes us relaxes the people we look after.
Right.
So it's a two-way street. As we use energy healing on ourselves, it also affects the people that we're looking after. I've seen most of you probably already know this, but if you see someone with dementia or Parkinson's end stage and they're not very verbal, you can often touch them and they'll come out and look at you for a minute and then go back in. I consider that profound. I consider that healing right there, that there's a connection, both for the caregiver and for the patient themselves.
That's pretty fascinating. And now you were the head of a hospice. Now can you tell us how energy healing might have worked in that environment or in those situations with patients?
Sure. So there's a couple ways. First of all, for the caregivers, there's a way caregivers get full. Mm-hmm. We become full of looking after someone else, and there's no more space really left for ourselves.
Right.
From the perspective of energy healing, what's getting full is your energy field. So one way that energy healing is good or is quite useful is that their practice is to clear your energy field. So when you walk into a situation, instead of being flooded with what happened yesterday or what happened an hour ago, you can approach it anew. Mm-hmm. New eyes, usually we have a whole new attitude.
Right.
The second piece of energy healing is that we can touch other people and communicate with the people we're caring for through energy healing experiences, which will relax them and actually decrease their pain and sometimes bring them back to a place where there's less suffering.
Right.
And of course, one thing that caregivers are doing is they're watching another person suffer.
Right.
And as you watch someone else's suffering, you tend to take it on your own. So I don't see it as separate between who you're looking after and yourself as well. There's a way in which you can help both.
That makes a lot of sense. And now that we're talking about suffering and watching the ones we love suffer as caregivers, obviously there's a lot of stress that caregivers experience, and you have a lot of I think you have the ability with the teachings of energy healing to show us and tell us how we can perhaps deal with stress.
Mm-hmm. So one of the first thing I would say, and the easiest thing I would say, is to remember to breathe. slowly. And as we breathe, there's a wonderful breath called the 4-7-8 breath that you breathe in for 4, you hold it for 7, and then nice, long, slow exhale for the count of 8. And as you do that, envision yourself clearing and actually breathing the stress out. That's wonderful.
Can you show us
Sure.
maybe a
I'll show you
breathing
this one.
technique? Yeah.
So the first one, you'll see, I'm going to put my tongue on the roof of my mouth, although it's not that important for people who can't do it. So you,
Right.
and then you breathe in through your nose. So I'll count. It goes. Hold it. Out.
Mm-hmm.
And so you make a whooshing noise as you breathe out. You do it 4 times.
Okay.
And depending on the lung capacity of whoever's doing it, it can be as quick as 1, 2, 3, 4, 1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7, 8,
Mm-hmm.
or it can be much slower. So 1, 2, 3, 4, and then hold. We'll do one more. So breathe
Okay.
in, hold it, out.
That's very relaxing.
It is.
Yes.
And so we suggest that you do 4 breaths anytime you need it. And I get people to do it throughout the day. I mean, we have this idea that relaxing and energy healing techniques are a one-shot deal, but really it's something that you might want to practice throughout your day, 10, 15, 20 times a day. Practice that art of getting centered and grounded.
Oh, I love that. Thank you very much for sharing that. Now, you have a lot of experience working with caregivers and having been in hospice and being a medical doctor in general.
Yeah.
What are one of the biggest challenges, I think, one of the biggest challenges for caregivers is finding the time just for themselves. And so I'd like to ask you, what are some exercises besides breathing that maybe that caregivers can do just in a few minutes?
So my favorite one's called Shaking the Bones, and I can't show it to you here just because we have some constraints about the filming. But it's actually shaking the body, letting your head tilt to one side like a rag doll and shaking. Just shaking, 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 shaking out the feelings of grief, the feelings of overwhelm, the feelings of what's happened, shaking out all the experiences of the day.
Yeah.
It's almost like taking a bath in new energy. You shake, and we see animals do it, shaking it off.
That's great.
So there's a very simple practice that I do for about 5 minutes whenever I can called shaking the bones that'll shake it off, and it's not only a way of clearing and feeling re-energized, but it's a pick-me-up as well.
Yeah. What do you feel is one of the major reasons for burnout amongst caregivers, from a doctor's perspective?
So I think burnout is that it's multifaceted. One, I think we don't hire enough respite.
Yeah.
I don't think that we let other people do the job that we are doing
Yeah.
in terms of caring for other people. Sometimes rightly and sometimes it's a question of just letting go.
Yeah.
Secondly, I think we get full. We get full of the suffering and we don't know how to clear it. One of my friends who's a hospice physician said that, he instinctively takes a shower every day when he gets home. And all of a sudden he feels anew again. And we don't have the idea that we have to continue to clear ourselves and feel anew.
Right.
The other thing I think that causes burnout, of course, is the frustration with the lack of help that's out there,
Yeah.
which you're starting to remedy, which is wonderful.
Yes, I think the availability of shows like this online, where a lot of
Yeah.
caregivers that I hear from ask me, well, what can I do if I can't get to a support group? Because, a lot of these support groups out there, I mean,
Right.
while they're very helpful and emotionally supportive, they don't offer that care for the person, for the loved one. The loved one can't be left at home alone. So I think, thank you for coming on our show, by the way, to demonstrate these exercises and your knowledge about energy healing.
I think community. You're talking about
Yes.
community, and community is very,
Yes.
very healing. And
Yeah.
we forget that not only do the people we look
Yeah.
after need healing, but we need healing. And we
Right.
do it, women primarily do it through
Yeah.
talking to each other. So
Right.
finding a phone buddy and just having someone you can vent with and
Right.
things like that. Really
Now,
helpful.
one of the things I actually wanted to ask you about, because energy healing falls under what's called integrative medicine. Can you talk to us a little bit about integrative medicine and how that relates to alternative medicine and homeopathic medicine?
So integrative medicine is a new term that we're using that is based in conventional medicine, but we also use anything else that has evidence that's helpful. So I may use conventional medicine, traditional Chinese medicine like acupuncture, especially for chronic pain, herbs or dietary supplements like fish oil, and energy medicine, homeopathic medicine, exercise, nutrition, Ayurvedic medicine, which is an Indian style of medicine.
Right.
So an integrative medicine practitioner will practice any of these modalities along with conventional medicine, or they'll refer to it.
Right.
So we're trained what else will help. For
Right.
example, TMJ responds well to acupuncture, so I would refer to an acupuncturist.
TMJ being?
Lockjaw, temporal
Okay.
mandibular dysfunction, when people can't open their jaw. That's one
Right.
example. Or
Okay.
a peripheral neuropathy. Complementary and alternative medicine is pretty much a term that's an older term that means everything except for conventional medicine. So integrative medicine puts complementary and alternative medicine together with
Great.
conventional medicine. Homeopathic and naturopathic medicines are types of complementary and alternative medicine.
Got it.
Okay?
Okay.
So-
Now, are you seeing are there more doctors like you? Is this a trend amongst the medical community for integrative medicine? I'm
Yeah.
hoping.
Yeah, well, it's patient-driven, which you just, exemplified perfectly. It's patient-driven because all of us have mothers and grandmothers or cultures that we come from that have an alliance and a knowledge that other things,
Yes.
work. So, yeah, at the Arizona Center for Integrative Medicine, we're training somewhere between 60 and 100 physicians a year.
Right.
And on our website, you can find integrative medicine practitioners who've been trained.
Great. Now, I'm of Ecuadorian background, and I learned from your biography that you've worked with Mayan healers, and I was very excited to hear about that. Can you tell us a little bit about what you learned?
Sure. I've learned lots of things, all the way from the egg cleansing to different cleansing techniques which work in the energy field to using ceremony and touch to reach people in places that you normally can't reach them. I've
Right.
studied with all different types of energy, psychic surgery, abdominal massage, herbs. I mean, there's so many things that are, there's so many jewels out there in other cultures that we're finally able to bring into our
Yeah.
practice with conventional medicine as a partnership. It's exciting.
I'm so excited that that there are that you are doing this as a medical doctor and combining these, I
Yeah.
think ancient long theories and practices into your practice, and I think we should have more doctors like yourself
and
around.
we will, because what happens is you start practicing medicine,
Yeah.
you start noticing that chronic diseases, we need more tools in our toolbox. So as excited as you are, I'm just as
Good.
excited to be learning
Great.
this stuff because it can help my chronic pain patients, my patients who are, having difficulty. What else can we do for bed sores? Things like that.
Right.
Really
now,
helpful.
we're here in the East Coast. We're right here in New York City in our studio, and I know you do a lot of this in Arizona, and a lot of this is available out on the West Coast. I mean, is this growing nationally? Is it spreading nationally?
Yeah, it absolutely is growing nationally. There are a lot of medical schools and that are getting into it, and in New York there are a few integrative medicine clinics. So you can either look on the Arizona Center for Integrative Medicine website to look for one of our graduates, or you can find one of our graduates and call them and see if there are others. But there are
Right.
people peppered around the United States and the
Wonderful,
world.
wonderful. I hope there are even more in the next 5 to 10 years. I want to thank Dr. Chiasson
you.
for joining us today. This has been so enlightening, and I think what you're doing is so progressive. To learn more about Dr. Chiasson, you can visit her on her website at www.AnnMarieChiassonMD.com. Let me spell that out. It's AnnMarieChiassonMD.com. And her materials are available on Amazon.com, and they will also be available on eCareDiary.com's book section as well. So please check her out, and thank you for joining us. Welcome to New York City. And have a great trip back to Arizona. I just want to thank our audience for tuning in, and please join us for our next show next Friday. Thank you, and have a great weekend.